Namaste everyone, welcome back to my channel Physio Vitals. I am Dr. Ankita Sawant and today I am back with the topic on cervical radiculopathy. So in this session we'll discuss the cervical radiculopathy, which is a condition that affects the cervical spine and often causes pain, weakness or numbness in the arm. So it's commonly referred to as a pinched nerve or the impinged nerve, compressed nerve. So let's dive into its causes, anatomy, diagnosis and management, including physiotherapy interventions. So cervical radiculopathy is a condition that occurs when a nerve in the neck is compressed. This compression can cause pain, numbness, weakness and tingling in the arm, hand and even fingers. Today we'll explore the anatomy, physiology and treatment options. So moving further first to the anatomy. So the cervical spine consists of 7 cervical vertebrae, C1 to C7. Between each bones we have intervertebral discs and the spinal nerves. each cervical nerve exits through specific foramina to innervate different areas of the arm and the neck. So each cervical nerves exit through specific foramina to innervate different areas of the arm and neck. So the most commonly affected levels in radiculopathy are C5, C6 and C6, C7. Kindly note. So the cervical spine is made up of 7 vertebrae which are stacked on top of each other. These bones protect the spinal cord and provide support for the neck. Nerves branch out from the spinal cord, traveling through the space between the vertebra to reach the arm, hands and fingers. Moving further to the pathophysiology. Whereas before that we'll just quickly discuss the physiology. So the cervical spinal nerve transmit the sensory and the motor signals between the brain, neck and the upper limb. Okay, we are discussing the physiology first. So they maintain the communication between the central nervous system and the peripheral structures, enabling movements and the sensation. Now we'll discuss the pathophysiology of the cervical radiculopathy. So it occurs when a nerve root in the cervical spine is compressed or irritated due to herniated disc material impinges on the nerve, or the degenerative changes like the osteophytes formation or narrowing of the foramen. Then trauma, fractures or dislocation which compress the nerves. So this lead to inflammation and disruption of nerve function, causing symptoms such as pain, numbness and weakness in the upper extremity. So the basic pathophysiology of cervical radiculopathy mainly is compression, inflammation, radiculopathy, pain, numbness, weakness. So these are caused by herniated discs, degenerative changes or the trauma. Moving further now to the diagnostic investigation. So to confirm the cervical radiculopathy, these tests are commonly used, which are the physical examination, very much important. If you are an orthopedic or the physiotherapist, your physical examination is really important. You should have that full insight to do appropriate tests, to palpate, to observe and assess. So assessing motor, sensory and reflex abnormalities. So in physical examination, first and foremost thing, assessing the motor, sensory and reflex abnormalities. Imaging, X-ray to check for degenerative changes. So we need X-ray to see the degenerative changes. Is there any degenerative changes in the cervical spine? Then if required, MRI for the detailed visualization of the nerve impingement, and CT myelography if MRI is contraindicated. Then electrodiagnostic studies also we have. These are the EMG studies or NCES, nerve conduction studies or electromyography to evaluate nerve conduction. If you want a video on EMG or NCV, so I will definitely provide you in the upcoming videos. If you want such videos of diagnostic investigations, comment down whatever investigation you want me to explain. I will definitely cover that in my upcoming videos. So electrodiagnostic studies we can do. X-rays, as I said, can show the alignment of the bone. In that we can see the structure and the presence of any bone spurs or the fracture. Whereas in MRI scan provides a detailed images of the soft tissues, including the disc, nerve and the spinal cord. EMG and NCV, the electromyography and nerve conduction velocity test evaluate nerve function and can help determine the location and severity of the nerve compression. Moving further to the conservative treatment approaches. First and foremost, the most cases of the cervical radiculopathy are managed non-surgically. Medication is a very much first important aspect of the conservative treatment. So NSAIDs, non-steroidal anti-inflammatory drugs for pain and inflammation. Then we give muscle relaxants if spasm is present. So for that also you need proper examination. Before examination you cannot just randomly prescribe any medication. So NSAID for pain and inflammation, muscle relaxants for spasm if the spasm is present. Then lifestyle modification. Ergonomic adjustment. You need to advise your patients you need to give some ergonomic advices to the patient in order to avoid aggravating activities and the symptoms. So next is cervical collar. So temporary use to reduce the movement and inflammation, we need immobilization, proper support. Hence we prescribe cervical collar. Then epidural steroid injections to reduce inflammation around the nerve root. So epidural steroid injections can be a choice. So rest. Avoid activity that worsens your symptoms. Rest, very much important. Medications, as I already discussed, pain reliefs, muscle relaxants, anti-inflammatory medications can help manage pain and inflammation. Physical therapy, I'm going to cover that in upcoming video, in upcoming slide in detail. So exercise, stretching modalities like heat or cold can improve the strength, flexibility and pain relief. Moving further, very important, surgical intervention, which is usually rare. So if conservative measures fail or symptoms worsen, then surgery is indicated. So anterior cervical discectomy and fusion, which is also called as ACDF, anterior cervical discectomy and fusion. It is removing the herniated disc and fusing adjacent vertebra. Then we have cervical disc replacement, maintaining the mobility while relieving nerve pressure. So in order to relieve the pressure on the nerve, the cervical disc is replaced. Then foraminotomy, expanding the nerve root exit to reduce the compression. So we have discectomy, removal of the herniated disc to relieve the pressure on the nerve root. Fusion, joining two or more vertebrae together to stabilize the spine and prevent the further movement. So usually the surgery is very rare, but you should know, you should have the complete knowledge of it. Very important part of this lecture, physiotherapy management. First, physiotherapy plays a very important role, very vital role in management of the cervical radiculopathy. So first and foremost treatment after assessing the patient properly, that would be pain relief techniques, ice or heat application according to acute or chronic condition, time period. Is there a acute condition it is, or it's a chronic condition? So accordingly, in acute we use hot ice and in chronic we use hot packs. Then modalities like TENS, transcutaneous electrical nerve stimulation, TENS or the ultrasound therapy. Then in manual therapy we give soft tissue mobilization if required. Then cervical traction, very much important, cervical traction to relieve nerve compression. As the nerve is compressed, a gentle traction can relieve or decompress the nerve. Okay, so in manual therapy, soft tissue mobilization if the surrounding structure or the muscles are very stiff, or mobilization of the bone, and then slight distraction to relieve the nerve compression. Then exercise therapy, in that we focus on strengthening deep cervical flexor. Strengthening the deep cervical flexor is really important. Then stretching the tight muscles like the upper trapezius and levator scapulae. Stretching is really important. Stretching and strengthening goes hand in hand. If if the structures are really tight and you're just working on strength, it's not going to help. First you have to lengthen the muscle, relax the muscle, you have to stretch the muscle, you have to create the room, then you should work on the strength. Then scapular stabilization exercises should also be done. Then postural correction. Educate your patient on proper ergonomics. So ergonomic advices you should be giving to the patient. Use of therapeutic exercises to improve the postural alignment. Therapeutic exercises to improve the postural alignment. Very important structure or part of the therapy is ergonomic advice and the postural alignment. Then progressive return to activities, gradually reintroduction of daily tasks with proper biomechanics. So in most of the ortho cases, we need proper biomechanically oriented exercises. So if the structure gets derailed, we need to bring back that derailment into the alignment. So focusing, if your structure is not in a proper alignment, the surrounding structures are going to get compensated, and then because of that compensation or sometimes overcompensation, you can see some symptoms or such conditions can occur. So strength training exercises target neck and shoulder muscles to support the spine. Flexibility exercises, stretching helps improve range of motion and reduce the stiffness. Postural correction, as I said, it's really important. Proper posture is essential to prevent further strain on the neck. Ergonomic advices, soft collars if required, proper rest. Every 45 minutes you should get out of your chair. If you're sitting, if you have a desk job, you have to get up or from your seat, get a walk, do some normal mobility exercises head to toe, and then get back to work. If you are not following this, eventually in 5 to 10 years, you are going to get early symptoms of such conditions. So maintaining the proper posture is really important. If we do that, many such conditions can be avoided. So I hope this video was insightful. So that's a wrap up on the discussion on cervical radiculopathy. It's essential to address this condition early with a multidisciplinary approach, including physiotherapy, to improve the outcome and prevent complications. So thank you for watching. Don't forget to like, share and subscribe to stay updated on more physiotherapy related content. See you next time in the next video. God bless you all. Keep learning.